Cough and cold, common but disruptive illnesses. What is cough and cold? Common cold is a viral infection of the upper respiratory tract, mainly affecting the nose and throat. It is often accompanied by cough, which helps clear the airways of mucus or irritants. Though usually mild and self-limiting, cold and cough can cause discomfort and affect daily activities. Causes: caused by viruses, such as rhinoviruses, most common, coronaviruses, RSV, adenoviruses, etc. Spread through airborne droplets, coughing or sneezing, touching contaminated surfaces, close contact with infected people. Warning: symptoms: runny or stuffy nose, sore throat, cough, dry or with phlegm, sneezing, mild fever, common in children, headache, body aches, tiredness or weakness. Diagnosis: based on symptoms, no special tests usually needed. If symptoms persist or worsen, doctors may check for flu, COVID-19, or bacterial infections. Treatment: there is no cure for the common cold, but symptoms can be managed. 1. Home remedies: warm fluids, tea or soup, steam inhalation, salt water gargle, breast and hydration. 2. Medications for relief: paracetamol for fever or body aches, antihistamines for runny nose, cough syrups depending on dry or wet cough, decongestants, short-term use. Note: antibiotics are not effective unless there is a secondary bacterial infection. Prevention: wash hands regularly, avoid touching face with unwashed hands, stay away from sick people, cover mouth when coughing or sneezing, maintain a healthy immune system, diet, sleep, exercise. Final word: cold and cough are common but manageable. While they usually clear up in 7 to 10 days, proper care and rest are essential. See a doctor if symptoms last more than 2 weeks or worsen. BioBeat News: small symptoms, smart care.